Okay. Is it audible, madam?
Yes, you are audible. Am I audible?
Yes.
Okay.
Okay. Shall we
Namaste, good evening.
start?
Yeah, sure.
Okay. Good evening. We can start now.
Yeah.
Okay. Good evening, everyone. Namaste all. I'm Dr. Priya George, an Ayurveda doctor by profession, as well as an Sbeba practitioner. Today we are discussing about the topic back pain. Everything you should know. The talk will be in English language. I welcome Dr. Ramya Krishnan to this live session as a guest speaker. Welcome, madam. It's a privilege to have you here.
Thank you. Thank you.
Okay. She is an associate professor and HOD of the Dirvinguna department at Rajiv Gandhi Ayurveda Medical College, Mahi. Moreover, she is the co-founder of SBBA, that is Science-Based, Evidence-Based Ayurveda. I welcome each and every one of you to this Facebook Live. This is a public awareness program. All the questions and interactions of the public related to this topic would be entertained in the comment box. So after this session, we will discuss all your queries. We can start the session. Madam, we are looking forward an amazing learning experience from you. It's a very crucial topic, common topic. Okay. So as we all know that this back pain has become a very common problem nowadays in the society. This is a very common among the office-going people like IT professionals, banking professionals, etc. So my first question is, what all are the general reasons behind the rise of this back pain cases, especially among young adults?
Generally, it was something, back pain was something which is limited to the age group above 30, 35 years before. But nowadays, it is very common in young adults also. Young adults can be divided into people who are below 30 years and 30 to 40 years also. We can categorize them in the young group itself. So between 20 to 30 years, mainly it is by inflammation only. Below 20 years, back pain can happen with flu, viral fevers, etc. Any sort of infective fevers can cause back pain. Other than that, the very rare causes only are there, which I don't want to tell in this public awareness program because people will be worried whether they are having this. So below 20 years, most commonly, back pain is associated with some flu-like, viral fever-like diseases only. Inflammatory pain. It is inflammation which is happening on the muscles or joints or ligaments, whatever it is, in connection with infective fever. Flu, commonly we call as flu, or any kind of that dengue fever is called as breakbone fever. So such kind of pain, very high pain, very severe pain can be associated with infective fevers. But above 20 years, 20 to 30 years, autoimmune causes, spondyloarthropathy, it is called. So autoimmune causes, like there are many different kinds of diseases like ankylosing spondylitis, where inflammation is happening by autoimmunity. Antibodies are formed against body's own immune system attacking body's own tissues. That is what is called autoimmune diseases. So the first problem which happens in autoimmunity is inflammation. Inflammation can happen to vertebrae, spine, etc. And these vertebrae, actually there are joint spaces in between. So when inflammation happens, this fusion of spine can happen because that is what is called bamboo spine. The person cannot bend forward. It will be rigid and erect like bamboo. So such kind of pain happens in ankylosing spondylitis. So that is main cause 20 to 30 years. It can happen in other autoimmune diseases also. Back pain can happen, but mostly this is the one cause. And mild inflammation as such by sprain, we call it as sprain, by sudden movement, like those happens with badminton or tennis, or any sudden movement, bending and getting up, getting erect. suddenly. It can cause inflammation in the muscles. So inflammation in the muscles of the back can also produce back pain. So these inflammatory causes, autoimmune and non-autoimmune, are mostly the causes in youngsters. And it can be associated with other causes like not related to back. It can happen in pancreatitis, gallbladder stones. Back pain can be a feature. Sometimes abdominal aorta aneurysm, AAA. That is a very rare cause. Abdominal aorta aneurysm, dilatation of aorta, which can cause severe pain when it explodes, when it bursts. It can cause. These are all rare causes. Okay. So in youngsters, commonly it can be a renal colic, loin to groin pain, kidney stones, or bladder stone can also cause back pain. Sometimes in females, back pain of young females, it can be caused by pelvic infections, infections in pelvic organs, like it can be uterus, sometimes cervix infections, infections in the cervix, vagina, urinary tract infection, or other pelvic organs infection, endometriosis. There is another condition called endometriosis, which can cause, where endometrium means where the uterine bed of arteries, it will be formed in ovaries. Instead of remaining in uterus, that lining will be passing over to ovaries or some other place in the pelvis. It can cause severe back pain sometimes, which is associated with menstrual period. So these are the commonly occurring back pain in this young group categories, and it can be rarely by serious causes like metastasis of cancer, but generally that happens in older age group, cancer of the prostate, etc., not in young groups. So youngsters, these are the common causes.
Yeah. But in all these people, what are the causes of back pain?
In old age, the most common cause is, sometimes there is a condition called osteoarthritis of the spine, where degeneration happens in the vertebrae. The spine is composed of 33 vertebrae. So these vertebrae, in between there are cushion-like structures called disc, intervertebral disc. So sometimes this intervertebral disc can be damaged, or sometimes bone itself, vertebrae itself can damage by continuous. It can happen directly by degeneration or by persistent inflammation also. Continuous inflammation from middle age or young age, if it is not managed properly, it can cause, persistent inflammation can cause degeneration of the spine. So it is a degenerative kind of pain which is most common in old age groups. But even though it is degenerative cause, you have to rule out inflammation. Very severe inflammation might be associated with degeneration. So generally disc prolapse means there is an outer ring like portion, and inside there is a, what you call, very gel like portion inside in the disc. So when disc is prolapsing means the outer ring is broken and the inner pulposus and fibrosis. Outer ring is called fibrosis, inner thing is called pulposus. It is herniating out. It can irritate the spinal nerves. Once it is herniated, it can irritate the neighboring spinal nerves and it can cause pain. Sometimes disc itself can swollen up, can get swollen up, and it can cause pain by irritating nerves. It can reduce the spinal canal, that volume of the spinal canal, and compress the nerves. That can also cause back pain in old age. When we take an X-ray, we will find osteophytes, spur-like projections of the bone. Sometimes we can see degenerative changes of spine and the bone, spine or the bones in the X-ray. But degeneration as such will not cause pain unless it is that much severe. Inflammation is causing pain. That's what I told. Degeneration is always associated with inflammation also, because these osteophytes can irritate the neighboring structures. Disc can get irritated. It can, swelling can happen on the disc and it can cause pain, or it can affect the spinal nerves. It can compress the nerves and cause pain. So we have to assess from the nature of the pain whether it is inflammatory pain or degenerative pain, which can be done with SBB. And depending on the nature, most of the times you must know, public must know that disc tear or torn disc or protruded disc as such will not cause pain. Pain is happening secondary to this by irritation of nerves, compression of the nerves, inflammation of the disc, etc. So that is why doctors are prescribing NSAIDs, non-steroidal anti-inflammatory drugs, aimlessly. It can only block inflammation. It cannot reverse inflammation. It can only block inflammation. So some disturbance I'm getting. Are you getting it? Some noise?
Yes, yes. Raining is there.
Oh, maybe that's right. Okay.
Rain.
Fine.
That's right.
Fine. So this kind of specificity is there in SBEBA to assess. Old age doesn't mean spondylosis. Spondylosis is degeneration of the spine. So when a person is above 60 years, back pain comes immediately. You cannot diagnose it as spondylosis pain. Spondylosis might be there, I agree, but the pain might be due to the secondary cause, secondary reasons induced by spondylosis. So first we have to make the patient as comfortable as possible. We should make the patient out of painkillers, need of painkillers. Patient should be stable. Then we can focus on degeneration. So that is what is the most common cause of old age back pain. And old age back pain can also by cancer. Cancer is one main reason for old age back pain, especially elderly males. Prostate cancer. Prostate cancer can cause, there is a plexus of nerves which connect with the veins. So this cancer can spread through these veins to nerves, and it can cause pain it can cause testicular pain. Along with testicular pain, severe pain can happen in the back also, lower back also. Elderly patients at night, that is the specific feature of prostate cancer getting spread to spine. Night time the pain will be very high, and there will be frequent urges to urinate. And when we are checking the blood parameters, or when he is referred to a surgeon to understand the prostate, status of prostate, and also by PSA, specific antigen and other tests, it is possible to estimate whether cancer is there, and metastasis or spread of cancer cells have happened to spine also. It can cause very severe pain at night, especially at night. That is the main feature. Along with that, the patient will be having other features of general features of cancer, like very fast progressive weight loss, testicular pain sometimes, and there will be very malaise, very severe tiredness, and other features. So this is another main cause of old age back pain.
Now, what about TB, madam? Tuberculosis, spot spine.
Tuberculosis of spine can happen to anyone. It doesn't, irrespective of age, but generally it is seen in youngster age groups only. Nowadays, multi-drug resistance is happened. As you know, antibiotic resistance has become a main problem of the world today. So many patients, even though tuberculosis is primarily affecting lungs, it can spread to other parts of the body. It can affect spine also. Pott's disease, it is called tuberculosis of the spine. It can cause back pain. Another condition is osteomyelitis, where pus infection is happening to spine. That generally happens, pus formation in the spine by infection, generally by bacteria or fungus, which is happening secondary to hospital admission. A patient who is hospitalized for long period, after that he can get osteomyelitis sometimes of the spine. Pus accumulation can happen. Even sometimes infection can spread through blood to spine also, rarely. It can cause pus formation in the spine. So all types of back pain, we have to differentiate, understand the cause mechanisms, and manage. That is what is done in SBABA.
Madam, what about the metabolic errors, that is like diabetes analog with back pain?
Yeah,
Uh,
diabetes, actually obesity, diabetes, all these can slow down the metabolism. Slow down metabolism means weight gain will happen. So excess weight is one major cause of back pain in young adults and middle-aged adults also. Excess body weight because of sedentary activities. We know during lockdown period, people were remaining at home for long
yeah,
periods. So the only exercise was for mouth only, no other exercise, always
yeah,
eating and talking only. So the kind of food which they were eating at home, they were trying new recipes, eating rich foods without doing exercise, and they were not allowed to go outdoor, so they were locked inside. No, so no exercise. All this will slow down metabolism. When metabolism is slowed down and joint movements are restricted, definitely joints will become stiff, and again inflammation can develop in tissues. Slow metabolism will stimulate inflammation, and unhealthy immune activity can develop in muscles and joints, causing inflammation of muscles and joints, which can cause pain. And diabetes is associated with chronic inflammation. In diabetic patients, we always find chronic inflammation. Their inflammatory parameters will be sometimes elevated. They will be having obesity, sometimes excess weight. So their metabolic stimulation and accurate scientific nutrition schedule and weight loss, along with reversal of, along with optimization of metabolic status in the body, that itself will reverse their back pain without any specific, no specific back pain oriented protocols are required in such cases. Only thing, regulation of metabolism, optimization of metabolism, and reversal of inflammation. That will stabilize the patient. Yeah.
Madam, can history of fall be a main reason for back pain later in the later life? History of fall, fall.
Fall. Okay.
History of fall.
History of fall. Okay. Fall can cause trauma. If it is causing trauma in the spine or vertebra or disc or joints, in intervertebral joints, etc., any trauma has happened, that trauma can cause back pain immediately. Immediately back pain can happen. So we are having good protocols. SBBA has very effective protocols to repair the trauma as early as possible. Immediately after the person falls upon his back, we know what to do. What first aid is to be given. Murivenna is to be applied immediately. Murivenna is available in all pharmacies. It is a compulsory medicine to be kept at home. Murivenna. So this Murivenna soaked in cotton pad. It should not be done later. If it is done later, then the stage will change. Sometimes inflammation might have started, and it is not advisable to apply Murivenna after 2 hours or so. Immediately on trauma, immediately after falling down itself, Murivenna with soaked in cotton is to be kept on the back, and the patient has to stay on the tummy for some time, because that Murivenna itself will prevent or heal the trauma to a large extent. It will prevent the formation of hematoma or mild hairline fracture, etc. It will take care. You can do a bandage also with Murivenna and make it stay there for 12 to 24 hours also, with accurate internal medicine for healing. There are specific internal medications which repair the trauma very fast. In SBEBA, we are doing that. One medicine is enough. That one medicine after assessment of the trauma will be prescribed, and medicated water will be prescribed, and the patient is kept on monitoring. So this will, if it happens on head and all, hematoma is prevented to a large extent. The patient will not get even a swelling on the head. So that much accurate strategies are there in SBAB. It is not advisable to apply cold compress in the traumatic site. Generally, people apply ice pack and all. It is not advisable to apply ice packs on fall, because it can further cause nerve damage. It can further increase the chances of inflammation. So there are so many problems. It can facilitate clot formation. Always Murivanna Piju or Murivanna bandage is the best during any fall, and it should be done at the earliest possible. After 2 hours, don't apply Murivanna because it will be the stage will be different and it can cause opposite effect. It can stimulate inflammation and pain will worsen. So it is a first aid. Immediately after trauma, you have to do it. So fall is, but after fall also sometimes it will be healed and the patient will be fine. After 3 months or 6 months, patient will get severe back pain in that area. So it is not
Yeah.
because of fall. Fall has definitely caused a proneness for inflammation in that area. That is the point. Once you get injury in a body, that injury is not properly healed, sometimes proneness of inflammation happens. It is because of inflammation that you are getting pain after three months or 4 months or 3 weeks. After the pain subsides completely, you may get back pain after 3 months in the same area. You may be wondering why it is so. It is because
Mm.
proneness is there in that part of the spine, and you have to reverse inflammation which is happening there so that it will be healed naturally without much medication and procedures. So this is why back pain is recurring also in people because of mismanagement, most of the times mismanagement, wrong medications in Ayurveda, wrong treatment procedures, and exercises in contraindicated status. Physiotherapy like exercises in contraindicated status. There are certain stages where you should not be exercising. In such period, you are doing wrong exercise, you are doing exercise after food, etc. All these can trigger inflammation and it can cause pain. It can worsen the pain also.
Okay. Madam, if a person suffers from back pain, he will suddenly go to the lab and check the vitamin D, calcium, etc. Can you please show some light on this?
Actually, it is a common trend nowadays to check vitamin D, calcium, etc. To because it is
Mm.
considered as osteoporosis is prone to develop after 50 years. Nowadays, 30 years. Women's Horlicks advertisement is coming now. 25 years, 30 years. So people are actually fallen for such ads and such wrong things. Anti-knowledge is spreading more. So people are buying calcium supplements and gulping in. They are regularly checking serum calcium levels and vitamin D, as you said, vitamin B12, iron, all these
Yeah.
things. But the thing is that any of this, generally, if you are living in a healthy area where you are having a moderate economic financial status you are living in, you are eating a balanced diet, more or less eating a balanced diet, then there is no chance for you to get nutrient deficiency. That you should understand. There is no chance. The food which you are taking, normal healthy food in healthy status, it can ensure that you are getting all the enough nutrients, whether it be calcium, iron, vitamin D, whatever it is, you will be getting, your body will be absorbing, assimilating, and using. When these deficiencies are shown in the lab, it is happening either labs can manipulate or it can
Mm.
happen secondary to inflammatory pathologies in your body. If you are getting infection, if your infection is not reversed properly, you are having metabolic imbalance which is not rectified properly, if you are having immune disorders not rectified properly, inflammation chronic is there, chronic inflammation is there, which is not even known to you. You may not be having any features other than joint pains, occasional joint pains, etc. Nobody knows whether you have chronic inflammation. Even the doctor does not care nowadays. Any doctor does not care to check basic immune tests. Basic immune tests are not done. Only cholesterol, vitamin D, iron, calcium, all these tests are done by doctors. Basic blood test, complete blood count, etc. Immune status is to be known. That is not advised by doctors mostly. That is what I see in my practice. So these things will help to understand. So the impaired assimilation is happening. Even though you are taking milk, you are taking curd, because you are having some disease, some pathology, active pathology. It could be silent or it could be evident also. Because of that, your tissues are unable to use up or unable to assimilate the nutrients from your food. You may be taking wrong foods, wrong status, etc. So this can cause reduction in the levels of calcium, vitamin D, etc. But what is to be done there? We have to attend the pathology. Whether there is any problem, metabolic imbalance is there, digestion problem is there, whether immune problem is there, inflammation is there, all these are to be focused. And once the disease is focused and rectified, cause mechanisms are rectified, definitely this nutritional imbalance will also get rectified. But patients do not know that. When you are taking calcium supplements in wrong status, it can deposit on your arteries. You may even, the arteries become stiff and hard when calcium deposits are becoming excess on arteries. It can cause a heart attack, it can cause stroke, it can cause many other problems. Smooth muscle contraction can happen because of calcium deposition, abnormal. So it is very important that people are to be educated. Unless there is a very strong reason, but SBA can avoid calcium supplementation even in osteoporosis. Osteoporosis can be primary or secondary. It can be by some other reasons also, like prolonged steroid use. This is another cause of back pain, prolonged steroid use. It can cause back pain and avascular necrosis of femur. Even femur can cause, it can cause necrosis of femur, and it can cause back pain also sometimes, hip also. Degenerative changes in the hip and spine can happen secondary to steroid use, continuous steroid use. So these things, secondary, it is always nutrition's deficiency is happening secondary. You have to attend the primary cause and reverse it. Then it gets rectified. Yeah.
Madam, nowadays women are more prone to back pain, especially after delivery. Why is it so? Is it because of the epidural anesthesia during the C-section or something else?
Actually, postpartum back pain is like, it is a very common thing now. Women are complaining. I think most of the postpartum back pain is because of minor, because during labor, if it is natural labor, the woman has to strain, woman has to use many muscles which she had never used before, right? Pelvic muscles, back muscles, everything she has to use during the process of labor. So after that, minor inflammation can happen after this strong use of these muscles, labor muscles. And also sometimes hormonal changes during pregnancy. There can be weight gain. Even during pregnancy, there will be excess weight in the abdomen, as you know. There will be excess weight, and lordosis, backward curvature of spine can happen because of the excess weight in the abdomen, backward curvature of the spine. It is called as lordosis. It is very common. So excess pressure on the back and the spine can happen like because of this, especially women who are fat, who are having lot of weight. Definitely abdomen also will be more. So they are prone to get back pain. And after delivery, sometimes hormones during late pregnancy and throughout pregnancy, and after delivery for some period also, progesterone level will be high. So progesterone can also cause loosening of joints and muscles, and it can also cause stretching type of back pain. Sometimes dangerously pelvic infections, if it is natural labor also, or LSCS, cesarean also. Sometimes it can cause infections in the pelvis, infections in the stitch area, going inside, deep inside. And it can infection, pelvic inflammatory disease. It can also cause back pain along with fever and other features of inflammation and infection. Chills, etc. will be present. So these are the main causes. And this epidural anesthesia, many times it is considered as epidural anesthesia. I don't think epidural anesthesia as such can cause pain in the later stage. If at all pain is there, it will be there for some period, tenderness can be there in that area. But other than that, anesthesia effect subside, it is not intended to cause low back pain continuous persistent in later stage of life. So if it is happening, it is by inflammation. First thing you should be considering is inflammation. And this postpartum Ayurvedic care, women are prescribed so many lehyas, so many kashayas, and so many things like conventional Ayurveda care, not based on any principles, but based on conventional beliefs, tradition, treatment oriented experiences. Even qualified doctors are prescribing medicines in packages. It is very unscientific to prescribe so many medicines after pregnancy. I mean, after delivery. You have to consider the woman, whether she is, first stage is always to prevent infection, to protect the woman from infection and inflammation. Second stage for hormonal stabilization. So stage by stage, we have to consider the metabolic status, immune status, circulatory status, whether she was having any past ailments, whether she was having gestational diabetes, whether she was having hypothyroid. All these facts are to be assessed. It's not like after delivery, this many medicines, thing in buccal asylum, so many lehyas rich in jaggery, ghee, all these things are prescribed.
Ashwagandha, Dilation.
This can cause inflammation, aggravate the inflammation. I'm seeing women who are complaining of back pain after consuming, and oil application also. Very important, when to apply oil and when not to apply oil. Back pain doesn't mean oil. There are different kinds of pain. Inflammatory pain is there, infective pain is there, sometimes radiating from internal organs. Pain can radiate from internal organs. As I told you, pancreatitis or even peptic ulcer can cause back pain. So in such conditions, applying oil is not the solution. It can trigger inflammation. And as I told you, autoimmune conditions which can trigger inflammation. People are applying ointments, balms, and they consider it as it is Ayurveda, it is safe. It is not like that. You have to consider, only a scientific practitioner can assess, analyze the cause mechanisms of the pain, specific kind of back pain you are having. And sometimes dry heat will be advised. It's not like oil always. Dry heat with hot water bag will be advised sometimes. And it is not intended for Panchakarma. Back pain doesn't mean Panchakarma. Always. Most of 98 to 99% of back pain doesn't require any Panchakarma procedures. It is very wrong belief, and that's what conventional Ayurveda is based on: tradition oriented, experience oriented beliefs, oriented treatments, medicine oriented treatments, not science based medicine. So principles are not applied to appraise the patient, state and state. I think it is high time that treatment protocols are to emerge. Standard treatment protocols are to emerge in assessment of conditions, all diseases, and treatment also. Then only this situation. Otherwise, irrational treatments will be very high and detrimental impact will be also high.
Third question is, what are the treatment protocols for back pain as per SPBA, and how it is different from the conventional Ayurveda procedures which is going on now? That is Urichil, Pidichil and all.
Yeah, this Urichil, Pidichil and all are not at all intended in back pain. There are people who are doing massage. People think that Kalari is Ayurveda. Kalari is not Ayurveda. Kalari, people might be using Ayurveda medicines, but Kalari is not Ayurveda. There are Marma Vaidyas who are using Ayurveda medicines, but Marma Vaidya is not Ayurveda. Don't get confused. Ayurveda doctors will always analyze. There is no hard and fast protocol for back pain as such. Patient is to be patient, evaluation protocols are there. Cause mechanism specific to the patient. It is very dangerous in inflammatory status to massage the patient. Sometimes it is very, very what you call strong, powerful massage is given to the patient, and patient is unable to move. Is it not? I find such patients in my OPD regularly, like mismanaged with so much massage and oil massage and many other Panchakarma Virechana like procedures for back pain. Repeated Virechana, that induction of bowel movement with medication. So that procedure is called Virechana. That is done. It is a Panchakarma, very serious Panchakarma, which is to be adopted in very strictly intended conditions. Back pain doesn't mean Panchakarma. People are doing taking medication by themselves also over the counter. These are all very, very dangerous. Actually, according to the cause mechanisms, scientific, if it is inflammatory pain, inflammatory protocols are there in SBB. If it is like inflammatory pain will reverse in not more than 5 days. Generally, it requires only 5 days with minimum fragmented dosages of medication. If it is autoimmune inflammation, stage 2 will be required to rectify or stabilize the healthy immune system as much as possible. It's not like switch off mechanism. It is an ongoing process. So, but the patient will improve day by day. Pain will be nil without any painkillers. Such a kind of protocol is developed. What is autoimmune arthritis? SBBA has explored first time and published in the book Unveiling the Truths in Ayurveda. So that protocols are adopted. Then degenerative osteoarthritis, we have to understand whether inflammation is predominant or degeneration is predominant in the presenting stage. And accordingly, we are modifying the protocols according to state and stage. Definitely, we can prevent surgeries and other patient. We can improve the quality of range of movement of the patient. If the patient is on walking stick or walker, cannot walk without support, I mean, before, we can reverse the patient status to normal. He can manage to walk without, it is possible with these accurate implementation of protocols according to state and stage of SBBA. So, based on state and stage of the disease and the condition, we are modulating the protocols and we make sure that the patient is, once the patient is stabilized, if whenever the patient gets any back pain, we are educating the patient what to do. First aid is also educated. That is another unique feature of SBB. What to do in back pain, sudden back pain, right? Sudden back pain, what to do first. That is also advised. You have to do, you have to apply dry hot pack, what kind of diet you have to follow, scientific nutrition schedule, and whether you have to exercise or not, whether you can apply oil on your head, body, etc. Everything will be trained to you. It doesn't require medication. Most of the times, without medication, you can reverse your back pain. Science is guiding you. Ayurvedic science is guiding you. So that such a kind of education we can provide to patients, and patients can improve, recover even without seeing doctor. They can recover from back pain with this accurate SBABA oriented first aid education.
Most of the doctors prescribe Vasti treatment, that is Madhudailega Vasti, etc. for back pain patients. SBB, what is the opinion of SBB in this?
Vasti is mainly intended to, they might be giving with the intention to strengthen the pelvic, I mean, strengthen the vertebral column, spine, etc. For that, they might be giving Vasti. But if Vasti is required in very less condition, in my practice, I find that without Vasti, I am not having an IPD setting. I am managing lots and lots of back pain cases with OPD setting only. So, if there is a requirement of Vasti, it should be purely degenerative conditions. Purely degenerative conditions and weakness also. Sometimes weakness associated. Weakness doesn't mean Vasti also. Weakness can happen secondary to conditions like Guillain-Barré syndrome or stroke or post-infective. Sometimes after COVID also, I have seen patients with hip weakness and low back weakness along with pain. If you do Vasti in such condition, it can aggravate because inflammation is the cause. Inflammation of the nerves is the cause. So Vasti is not a universal antidote for back pain. And even Kadi Vasti, there is a procedure which is not mentioned in Samhitas. Even oil is made to stay over the back of the patient, lower back, lumbar region of the patient, and Kadi Vasti is done. So Kadi Vasti also, if in inflammatory status it is done, patient will get very severe pain. And the spirit chill, urit chill, all these things. Keraliya Panchakarma, it is mentioned under Keraliya Panchakarma. It's not Panchakarma, just Kerala Vaidyas have developed a protocol, Keraliya Panchakarma. In that, Kaya Seka, etc. are done. But it is, originally, it is Purva Karma in Ayurveda. But the thing is that if it is done in wrong status, not only that the pains will aggravate, but also metabolic status of the patient will worsen. Even he can get a heart attack if he is doing pirichil in the wrong stage. If he is a diabetic patient and his sugar levels are not in control, if he is having hypertension, if he is having proneness to stroke, when these things are done without scientific appraisal of the cause mechanism, state and stage of the patient, it can cause very severe fatal hazards to the patient. And the patient and the relatives, bystanders will not be knowing that it is a rational procedure that it happened. That is the greatest misfortune in Ayurveda. Neither the doctor nor the patient will know that it is by irrational treatment that it happened. They consider it as their fate and they will be immediately rushed to allopathy or modern medicine. Yeah, so modern medicine doctors consider it as Ayurveda doctors are mismanaging, and to a large extent it is true also, because there are no standard protocols to appraise the patient in infective status, inflammatory status, what to do, degenerative status, autoimmune inflammation, what to do. Instead of that, Ayurveda doctors are very much interested to learn marma therapies, pirichil, udichil, all these things. I mean, chavitti udichil, all these things. Instead of learning scientific Ayurveda to reverse back pain without much problems, without much medications, with the modification of scientific lifestyle, diet and medicated water, minimum medication, you can reverse it most of the times. But Ayurveda doctors are more interested in studying all the other things outside Ayurveda things, yoga, all these things are advised in back pain conditions. Exercise, postural exercises. That is also very important, Dr. Priya, because postural exercises like yoga, etc., in the status of inflammation, it can aggravate inflammation. So Ayurveda doctors consider it as yoga is good for this. So they are implementing. So they are considering only that without appraisal of cause mechanisms. So not good in all sort of back pain, even yoga and other things. Yeah.
Madam, on which stage we doctors advise surgery for a back pain patient?
Yeah, that's a good question, because most of the times nowadays surgery is, people are opting for surgery even in osteoarthritis of knee joint also, not only in back. So surgery, actually in my practice, I have seen many patients who are recommended for surgery, but they are able to be reversed back to normal life, near to normal or normal life in the quality of movement and all. They can forget about surgery in most of the cases, because what is done in surgery is just what you call removal of that particular portion of the disc, discectomy or laminectomy, that particular bone proportion, I mean that destroyed portion of the bone or vertebra, that is removed, or an artificial joint is fixed between the bones. Artificial joint, metal joint or plastic joint is fixed, and it is not a permanent solution for back pain. Again, when a foreign body is or a foreign or an artificial intervention is done, again the tissues can get irritated, inflammation can happen on the disc and surrounding regions, it can irritate nerves, and again pains can come back. So surgery as such is the last of all last resorts of back pain. So in scientific Ayurveda, Sbeba is managing patients, lots of patients, to avoid surgery. I have not seen even a single patient necessary to recommend surgery of the lower back. This is the condition. So as modern medicine, they are giving painkillers in the first stage, then they are giving physiotherapy, and when physiotherapy is also not working, when the pain gets unbearable because of persistent inflammation or some other cause, they are advising surgery. So surgery is just for a repair. temporary repair of that area. That is what is expected to be done. And again, pain can happen. Nearby structures will get inflamed, irritated. It can cause compression of the nerves. So lifestyle modification is most important. Lifestyle modification by accurate exercise, um, scientific nutrition schedule adoption, 5 days of every month to ensure that metabolic status is good. There is no inflammation happening. Even people who are having very poor joints in X-ray, in the vertebral joints, completely degenerated, osteophytes are there. They are also able to live a normal life with SBA protocols. That is what they will be coming to a very worst level, detrimental level of pain. They are advised by doctors that because of this degeneration, they are having this pain. That's what I told. It is not necessary that you are having pain by degeneration. And you may be asked for bed rest also. It's not advisable. Physical activity is very important to intended physical activity. It's not that you should be doing very vigorous physical activity, but ensure that you, especially IT professionals who are having back pain, they will be continuously sitting for long period. It's very important that they should get up and walk in between to improve the, joints are to move in between metabolism, especially if they are in AC room. This can slow down metabolism. Inflammation can happen in tissues. So it is important to improve circulation. They have to circulation in the joints. They have to get up and walk. It's very important. Drinking boiled water, very important. Nowadays, people are drinking RO water, not boiled. Boiled water drinking, and what you are doing during inflammation. That DASH is the protocol. D for diet, E for exercise, S for sleep. Whether you are sleeping in the daytime, that can also trigger inflammation. And H, how you are managing. It's most important. How you are managing back pain, how you are managing joint pain, whether you are doing something to reverse cause mechanisms or whether you are using something to block inflammation. Anti-inflammatory drugs, they are only blocking inflammation. They are not reversing inflammation cause mechanisms. So again and again, inflammation can happen. So real cause mechanisms are addressed in Ayurvedic science. SBA has explored that, and SBA is practicing the protocols according to the cause mechanisms.
Yeah. Madam, is it apt to wear a lumbar belt for a person with back pain? And also, what are the precautions to be taken by a back pain patient?
Lumbar belt as such is not needed in back pain. You have to, SBA practitioners are confident enough to remove lumbar belt from day one itself. Only purpose of lumbar belt is to keep the joint, restrict the movement of the joint. So the pain will be less. It is like something like artificial method to make you comfortable. That's all. But the thing is that inflammation cause mechanisms are actively in progress. So with lumbar belt, by restricting the joint movement, it's not possible to stimulate the metabolism in the joint, to stimulate the circulation in the joint. It is very important that you should be moving the joint as much as possible with necessary steps, like if it is inflammatory, you can apply hot water bag, dry heat can be applied. Sometimes we use a procedure called Ubanaha, medicated bandage, which will be tied at night in the lower back, and morning you will be asked to remove it and wash with hot water. So these procedures help you to get out of lumbar belt easily. And there is no worry about whether some patients will tell doctor, if I remove this belt, it will be terrible. Then first thing what I advise is to remove the belt. Once SBA protocols are initiated, pain score can be asked to be reported by the patient. Initially 5 by 5, after 2 hours, after 6 hours, after 24 hours, how pain is coming down. So generally we do that. We train our SBA practitioners also to do that, so that we can ensure that we are undergoing the right protocols for the cause mechanisms. So lumbar belt is not advisable. Yeah.
Okay. Precautions to be taken by a back pain patient.
I think I
That is,
told some precautions. I
yeah, at all.
schedule, ensuring sufficient joint movement, avoiding daytime rest and sleep, unless there is a very serious reason to
Yeah.
stay on bed. You should not be staying on bed, especially postpartum stage after a certain period, 28 days. It's not necessary to stay on bed for 28 days unless it is cesarean. If it is cesarean, also the patient should be asked to sit up, and some
Yeah.
movements should be given to the body. If you are remaining on bed forever, all your muscles, joints, everywhere it can go. Sometimes metabolism can become slow. You are prone to get inflammation. Muscle wasting can happen. Not in one day, but if you are not using muscle, it will become weak. Muscle weakness, ligaments can become loose. All these can cause joint pains of different kinds. So it is important physically active. Physical activity is important in all the age groups, not only in young age, above 16. Senior citizens also should ensure that they are regularly engaged in some sort of physical activity appropriate to their body status. 15 minutes morning and 10 minutes evening. That is enough. Not 1 hour or 2 hours. 15
Mhm.
minutes morning, 10 minutes evening. And best thing is stair climbing exercise. That is the best thing. So if you are doing this, it is a good thing. And all sort of pains are addressed with appropriate measures. You should not be ignoring back pain, especially if it is not subsiding after 48 hours also. Sometimes it can be by urinary
Okay.
infection or pelvic infection or internal organ. You should be definitely seeing an Sbeba practitioner, scientific Ayurveda practitioner, to understand why you are getting back pain this much. Maybe we will advise a blood test. A simple blood test will help us to understand what is the reason. We will ask your history, how many days it is happening, whether you are having any other disease, and past illness, any past illness were there. Many things we'll be asking about your addictions, diet, exercise. Okay, nowadays gym, people are trying new things in the gym,
Yeah.
and it is also causing one major cause of back pain in young adults. They are eating and going to
Yeah.
gym.
Weightlifting.
What I understand, yeah, their trainers are asking to eat and go. So
Yes, yeah.
yeah, eating and going doing exercise can cause inflammation. It is well proven in
Mhm.
Ayurvedic science. But such kind of erroneous things can cause back pain or any other joint pain.
Okay. I think we have a few questions in the comment box. Let's have a look at it.
Yeah, yeah, sure.
Vidya Subramanian, what is the cause of getting pain in the hand, sleeve area, or wrist area while trying to get an item by stretching your hand? Is this also due to inflammation? How to get rid of this? Is there any treatment in SBB? Okay.
Actually, it could be by tendonitis. Tendons are there, bone to muscle connection is there by ligaments, bone to bone connection is there, tendons are there. So sometimes it can be by inflammation of the tendon or ligaments or muscles or joints, whatever it is. It can be a systemic cause, whole body cause, or it can be a local cause. Sometimes it can be a sprain, muscle inflammation only. So
Yeah.
we have to address the cause mechanisms. This maybe can definitely help in such conditions.
Yeah. One more question is there. These days, a lot of doctors are suggesting cold packs for all types of pains instead of hot pack, back injuries, sports injuries, etc. Yeah, I already discussed. Then these days, why there is suddenly doctors are suggesting knee and hip replacement for seniors to improve quality of life. What has changed suddenly?
That's
Like that
what,
one comment.
that's also addressed, I think. There is
Yeah.
surgery should not be considered as first option. Always replacement and restoration are much more healthier than replacement. You should be
Yeah.
remembering repair and restoration. are always healthier for body than replacement, unless there is a cancer or something else. Serious cause. Do not think of surgery as first option.
Okay. Then one question is there. Can you please explain about diet and medicated water?
That we cannot explain a general principle like this diet, if you eat, you will be free from back pain. That's why I'm not explaining. Back pain cause mechanisms vary, no. So depending on the cause mechanisms, we are modifying diet. And medicated water, generally it is better to drink boiled water. Boiled water itself will prevent inflammation because it can stimulate metabolism. And you can avoid this red water. In Kerala, we use patmaka. There is a herb called patmaka, padimuga in Malayalam. Sometimes red water will be there. Khadira, patmaka, all these. Yeah, khadira, acacia cottage. All these are used. These things are slow. This will slow down the metabolism. These medicines. So medicated water in Kerala, which is served in feast, hotels, they can trigger inflammation. So you have to avoid such water. Don't think that medicated water, so it is good for my body. Ask for plain boiled water. That itself will prevent inflammation to a large extent. Make it a habit to drink boiled water always. And medication can be decided only according to your cause mechanism by the doctor, be a practitioner.
Okay. One more question is there, ma'am. How Muruvanna causes contradictory effect when used after 2 hours of fall?
Okay, when a part of a body gets injured, naturally immune response gets activated for healing. Immune mechanisms get activated. Tissue injury happen, no. So healing is done by immune mechanisms also get activated. As a part of that, if you are applying wrong oil can trigger inflammation is also an immune response. It is a healthy immune response to reverse the injury. But oil application can cause trigger unhealthy inflammation, very high level of inflammation, for which cause mechanism, logical reasoning is provided in Ayurvedic science. Ayurvedic science is explaining how and why oil application is unscientific in inflammation. So it can cause trigger inflammation, it can cause worsening of pain. And when inflammation is more, the healing also gets slow. Inflammation, adequate inflammation naturally happening and healing is happening. But if inflammation is abnormally high, it can also slow down the natural healing process because it has become an inflammatory stage, inflammatory disease. So inflammatory disease means severe pain can happen. That immediately if you are applying, that will not be there. As soon as immediately after trauma, Purivanna will facilitate healing very fast. Tissue injury, any kind of injury, even hairline fractures, everything. Fractures.
Next question.
Yeah.
Yeah. Next question is stair climbing alone exercise good for diabetic and thyroid
Yeah, of
patients?
course. Of course. Unless there are other reasons to avoid recommending that. Very rarely some reasons will be there where patient should not be doing stair climbing. Other than that, everyone can do that. Empty stomach.
Yeah. Then nowadays, younger girls complaining of back pain. What is the reason, ma'am?
Most common reason could be endometriosis is now getting very common, and it can be also by abnormal exercises which they are doing. Sometimes abnormal exercises, like most of the girls are doing uh, different kinds of kalari and other karate and other such things. Sometimes they will be doing after food. It doesn't mean that they are to be avoided. They have to do it in a proper way, and they have to do it in an empty stomach status. That is very important. So whenever an inflammation is there, this will trigger all the pains. It is like fever. Inflammation is like fever. It will subside very fast. Sometimes endometriosis can be, as I explained before, endometriosis is another cause. Pelvic infection, urinary infection, all these can cause back pain in girls. Hormonal dysfunction, dysmenorrhea just before menstrual period. Menstrual pain can also cause back pain. pelvic congestion can cause back pain. These are all simple, without non-medicational remedies can cure this condition with SBBA guidelines.
Yeah. Yeah. And one question is there, ma'am, as we know, without Vada there is no pain, and Thaila is best for Vada Shamana. Then why oil is not prescribed for backache?
Actually, it is a technical question. I think it's not appropriate to address the question, but still, Vada is not like Vada. What you mean, Vada is a dosha, right? So, dosha will not cause, dosha present in the body does not mean pain. Vada, Pitta, and Kapha are there in the body always, in every cell, but we are not having pain. So, it is like there are so many things to address. Inflammatory pain is what is explored in Ayurveda. If you are an Ayurveda student, you can read the Unveiling the Truths in Ayurveda by Dr. Rajkumar, where a detailed exploration is done regarding the answer to your question specifically. That is, I think that will be appropriate because it is a technical question, not to be addressed in this platform. Yeah.
Then one question, how to recover from muscle or body fatigue after illness?
Body fatigue. Okay.
Yeah, fatigue.
The thing is that when you are reversed of the illness properly, fatigue will also subside. It's not like for fatigue another medicine, different medicine. For recovery of illness, different medicine. It's not like that in Ayurveda. When you are given the scientific medicine to reverse your disease, generally fatigue is associated with infections, viral fever, etc. So when you are adopting the right scientific protocols of Ayurveda for infection, when you recover from infection, along with that, fatigue will also subside. Not only that it will subside, you will feel energetic, you will feel more enthusiastic because your immune system will get healthy, stabilized, and your hunger will improve, your metabolism will improve, your circulation will improve. So you feel more active and healthy. So that is not a separate thing to be done with medications. Proper reversal of the cause mechanism of tiredness naturally relieve fatigue also.
Okay. I think we have answered all the questions. Okay. 7:30 now. We can wind up the session.
Yeah, sure. Once again, thank you for that effort, your dedicated effort to propagate this thing. Actually, this is an idea of Dr. Priya only.
Okay.
So she was asking me whether this kind of programs will enlighten the public regarding different aspects of the. Generally, there are so many myths regarding Ayurvedic treatment, all these aspects. So people who are watching this, who want to suggest any topic also, they can suggest to Dr. Priya so that we can consider it later. Yeah. So hope we continue this again. Yeah. Thank God.
Yeah.
Thank you.
Okay, madam. Thank you for this wonderful session. I thank you on behalf of the SBBA community. Okay. Thank you, one and all. We will see you soon with another live session next week. Okay.
My duty.
Good night.
My duty and pleasure. Take care, all of you. Bye.
Okay. Good night.
Good night.
Take care. Bye.